And this quote just hits the nail on the head, doesn't it? Serious diseases don't always show up with a huge dramatic entrance. A lot of the time, they start with just a whisper. And learning how to hear that whisper, well, that's what we're going to focus on.
So, that's the big question, right? What exactly are these signals? How do we get better at spotting them, not just in ourselves, but in the people we care about? Let's break it all down.
First up, we're going to look at symptoms that aren't just in one specific spot, but the kind that affect your entire system. These are the ones that are so easy to mistake for just being stressed out or feeling a little off. All right, symptom number 1, unexplained weight loss. Now, I know what you're thinking, losing a few pounds without trying might sound pretty good. But if you haven't actually changed your diet or started hitting the gym more, it's a sign that your body is trying to tell you something. So what's the threshold we're talking about? Well, doctors start to get concerned when a person unintentionally loses more than 5 to 10% of their body weight over, say, 6 to 12 months. That's a really significant drop, and it's something that definitely needs a closer look.
And you might be wondering, why does this even happen? Well, believe it or not, some tumors can actually hijack your body's metabolism and cause it to burn way more energy. This is a pretty common early sign for cancers of the pancreas, lungs, and stomach, for example.
Okay, this next one is a biggie, persistent fatigue. And I'm not just talking about being tired after a long week at work. No, this is a deep, just bone-deep kind of exhaustion that sleep doesn't seem to touch. And the difference here is absolutely crucial. Normal tiredness, you get a good night's sleep, you feel better. But this type of fatigue, it's constant. It's so overwhelming, it can actually get in the way of your daily life. It is a whole other level of tired. This kind of unrelenting fatigue is a really common signal in blood cancers, like leukemia and lymphoma, and also colon cancer. It's basically your body dealing with a massive internal battle, and that just drains all of your energy. Okay, let's move on. Next, we're going to look at alerts that are more visible and tangible. The signs you can actually see with your own eyes or feel with your own hands. This one is as straightforward as it gets. Any type of bleeding that's unusual for you needs to be checked out by a doctor. Period. Seriously, it is not something you want to wait on. So, for example, seeing blood in your stool could point toward colorectal cancer. Blood in your urine might be a sign of a bladder or kidney issue. Coughing up blood, that needs immediate attention for possible lung cancer. And for women, any abnormal vaginal bleeding could be linked to cervical or uterine cancers. Okay, finding a new lump or some kind of thickened area on your skin, I get it, that can be terrifying, but it's so important to remember that most lumps are not cancerous. The key is just to get them looked at, Don't ignore it. The ones you really want to pay attention to are those that stick around for weeks or maybe seem to be growing or feel kind of hard and irregular. This is exactly how many breast, thyroid, and testicular cancers are first found, just by someone noticing a change and actually doing something about it. Our skin is our body's largest organ, and it's also the place where we can most easily spot when something's up. Just keeping an eye on your moles or any new spots on your skin is such a critical habit to get into. And there's a fantastic tool for this called the ABCD rule. It is such a simple way to check your moles. Just ask yourself, A, is it asymmetrical? B, is the border irregular? C, does it have multiple colors? D, is its diameter larger than a pencil eraser? And probably the most important one, E, is it evolving or changing over time? All right, our final category covers what we can call persistent discomforts, those nagging aches, those pains that just don't seem to want to go away. Look, we all get aches and pains. That's just part of life. But pain that has no clear cause, pain that just lingers for weeks or even months, that is your body's alarm system, and it's trying to tell you that something is wrong. For example, headaches that just will not quit could, in some rare cases, be a sign of a brain tumor. Or constant, deep bone pain might be related to bone cancers, or even cancer that has spread. Again, the key word here, the one I want you to remember, is persistent. Think about it. A cough from a cold, that should be gone in a couple of weeks, right? But a nagging cough that lasts for more than 3 or 4 weeks, especially if you're a smoker, that is a major red flag. And if that cough comes with friends, like chest pain, coughing up blood, or a lasting change in your voice, like hoarseness, it is absolutely time to get it checked out for potential lung or throat cancers. And finally, let's talk about digestive issues that just don't quit. This isn't about that occasional heartburn you get after a super spicy meal. No, this is about chronic indigestion, or that weird feeling that food is getting stuck in your throat that just doesn't get better with the usual remedies.
These kinds of symptoms can be early signals of cancers in the esophagus, the stomach, or the throat. And getting an early examination can make all the difference in the world in catching these at a stage where they're really treatable.
Ooh, okay, we have covered a lot of pretty concerning signs. So now, for the most important part, what do you actually do with all this information? I really want this point to sink in. Please hear this loud and clear. Having one of these symptoms does not mean you have cancer. Most of the time, these things are caused by common, totally harmless conditions. This is not about causing panic. It's about building awareness. And this all brings us to something I like to call the persistence principle. It's a really simple rule of thumb. If any new or unusual symptom lasts for more than 2 or 3 weeks, the smartest, safest, best decision you can make is always to get it checked out. Because ultimately, that's what this is all about, right? It's about not ignoring what your body is trying to tell you, not putting off that doctor's appointment. And why? Because when it comes to fighting cancer, early detection is without a doubt the single most powerful tool we have. Being aware isn't about being afraid, it's about being empowered.